How's it going, everybody? This is Dr. Bleam from Freedom Chiropractic and Rehab. Just wanted to take a minute to show you a couple of exercises that we've been using recently to help our patients kind of program their breathing patterns. What we don't think about a lot of the times is that breathing is an exercise, right? It's a coordinated movement of muscles to accomplish a goal, kind of like a squat. But the difference is not many people are squatting 20,000 times a day. So it's really important to have the right strategy and approach so you can make breathing as effective and efficient as possible. So what we'll do first when we're testing a patient is have them lie flat on their back, knees bent, feet flat on the floor. So like this. From here, I'm going to place one hand on my chest and one hand on my belly. And all I want to do is breathe during this time. Within about 2 to 3 breaths, you should be able to tell which hand is moving more. Is it your chest hand or your belly hand? Ideally, what we want to see is with an inhale, we're going to see the belly rise. And then with an exhale, we'll see the belly drop. This happens because the diaphragm contracts. When it contracts, it descends, which changes intra-abdominal pressure. As it descends, it causes the belly to rise. That also allows the lungs to take in the maximum amount of oxygen. Then what we'll see is we'll see that belly drop as the diaphragm relaxes and rises. When it rises, you're forcing carbon dioxide out of the lungs. This is the ideal way to breathe. Belly rises with an inhale and falls with an exhale. If you found that when you were breathing, you're feeling the belly rise with an exhale and fall with an inhale, what you're doing then is what we call paradoxical breathing. And you really want to work to kind of change that pattern as much as possible. We call it paradoxical because it's the opposite of what we look for. It looks kind of like this. If you feel this, this is what you're doing. You'll see that chest rise, but with an inhale. And then it'll fall, and the belly rises with an exhale. That is not as efficient as abdominal or belly breathing. So if you find yourself in the pattern where your chest is rising with an inhale and belly is falling, or rising rather, with an exhale, what you want to do is practice an exercise we call crocodile breathing. Crocodile breathing is we're going to lay on our stomach, rest your chin on 2 fists, and all that I want you to do is take a deep breath in. When you're doing that, you should be pushing your belly into the floor. As you push your belly into the floor, obviously the floor is not going to allow that. So much like when you see a crocodile in the zoo breathe, you'll see the belly rise, or expand rather, and then rise. So if you watch my back closely, you should be able to see that. Another simple reset that you can do is going back in that same position that you were in before, on your back, knees bent, feet flat on the floor, but place a weighted object on your stomach. As an example, I'll use this small kettlebell. And what I want to do is place that on my belly, and I can take a deep breath in. It's probably easier to lay it flat. As I take a deep breath in, what I want to do is use my abdomen to push the kettlebell up in the air. So it'll look like this. So at home, if you don't have a small kettlebell laying around that you can use, what you can do is just put a textbook on your stomach, or a liter bottle of water, something that has a little bit of heft to it. Now, if you have any questions, don't hesitate to shoot an email or give us a call. The email address is info@freedom-chiro.com, and our phone number is 410-795-0400. We're here to help and happy to do it, so if there's something we can help you with, let us know. Remember, everything we do, it's really important to keep in mind that movement is medicine. Thank you very much and have a great day.